welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top news. A patient who was on verge of dying due to rare blood pressure of lungs was successfully saved at the Sir Gangaram Hospital in New Delhi. A 19-year-old female resident at Eastern UP was seen with history of shortness of breath, persistent nausea and palpitations. The parents correlated these complaints with her unwilling to attend school. They noticed that she would confine to the room without much activity. She was shown in a nearby hospital where her routine blood investigations and chest X-ray were done and reported normal. As for the parents, patient also had decreased attention span in school and complained of persistent palpitations. Psychiatry opinion and regular counseling was done for the same, as they attributed the illness towards hesitancy in attending her classes. Dr. Atul Kakar, Vice Chairman and Department of Medicine at Sir Gangaram Hospital, who diagnosed that she was having symptoms suggestive of pulmonary artery hypertension based upon her clinical examination and echocardiography. Her symptoms were attributed towards rare condition, which is primary pulmonary hypertension. Primary pulmonary artery hypertension is a very rare identity and occurs in 1 to 2 patients in every 10 lakh population. Patient was started on drugs to decrease the PAH, which included endothelin receptor antagonist along with phosphodiesterase 5 inhibitor. These drugs are now available for treatment of this rare disease. Over the last 5 years, patient has symptomatically improved and her pulmonary pressures are under control. Dr. Kakar diagnosed this condition, and as the medication for this condition is expensive and lifelong, arranged for the funds from Uttar Pradesh Chief Minister Relief Fund. The diagnosis of PAH is usually missed because of non-specific presentation. Speaking to Medical Dialogues about this rare case, Dr. Atul Kakar said, "Welcome to Medical Dialogues, Dr. Atul. If I talk about this case, how were you able to diagnose this rare disease?"
Yeah, so there's a very high index of suspicion is required, especially if the patient is complaining of shortness of breath. There were a couple of tests to be done, which obviously know exactly about the disease. So we got the relevant test done to know, and once we had the test available, we then tried to rule out the secondary causes of this condition, and very successfully we were able to do all the possible tests and diagnose this kind of a rare condition.
Okay, so what points should one keep in mind so that such conditions don't go undiagnosed?
Okay, so the most important thing is the patient is always right. In case he is complaining, we should listen to the complaint and try to at least find out some cause for it. That's a very important thing. So that's one of the learning things for everyone, that if the patient is complaining of persistent, it cannot be a psychiatric illness always, So here the parents were attributing it to the psychiatric problem, which was related to a poor school performance. That was the thing. So that's an important issue.
So is she well now? She's on medication, so there's no need of any surgical treatment further?
Yeah, she's on medication. She's doing well. She is almost finishing her school now. Her performance has increased. Her shortness of breath has improved, and she's doing quite well. She's fine absolutely now. So surgery is not usually required. Actually, medication which helps, and these medicines also, they've come in the last about 10 years or so in the market. They were initially not available, but in the last 10-12 years, the market has seen mushroom of drugs, available for this kind of a condition. And that's the reason why we were able to treat also this patient symptomatically.
Thank you, Dr. Atul. Thank you so much for your time. The case was managed extremely well with tremendous efficiency and expertise of Dr. Atul and his team. Salute for giving new lease of life to patient. Because of availability of newer drugs, these patients are living longer with better quality of life. The patient is now currently doing well and is on regular follow-up. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.